Metformin versus placebo in obese pregnant women without diabetes mellitus. Background: obesity is associated with an increased risk of adverse pregnancy outcome. Lifestyle intervention studies have not shown improved outcomes. Metformin improves insulin sensitivity, and in pregnant patients with gestational diabetes, it leads to the less weight gain than occur with those who do not take metformin.
Welcome to Blood Sugar Magic. This episode is on Metformin. Welcome to Blood Sugar Magic.
Today's provider is for Australian audience nation. Place advice given to business.
Note that Metformin is a chemical. It's available in Australia as Metformin and Metformin this year is treated type 2 diabetes. Reduction in the risk of a heart attack. It does not cause pain, but it's suitable for people who are overweight, provided they have been administered. Slow agent, XR, is about the XR can be once a day for a short activation. The XR can be Metformin can help reduce total cholesterol, LDL or bad cholesterol, and triglycerides. Thank you for watching Blood Sugar Magic, or BSM. We hope to see you next week.
Metformin, with diabetes, with the virus, and medics.
Methods. In this double-blind placebo-controlled trial, we randomly assigned pregnant women without diabetes who has a body mass index of more than 85 to receive metformin at a dose of 3.0 grams per day or placebo from 12 to 8 weeks of gestation until delivery. The primary outcome was reduction in the median neonatal birth weight z-scored by 0.3 st. Secondary outcomes include maternal gestational weight gain and incidence of gestational diabetes or preeclampsia, as well as the incidence of adverse neonatal outcomes.
Thank you for watching Blood Sugar Magic, or BSM. We hope to see you next week.
Hi, I'm Phil Lewis. Welcome to type 2 diabetes. Please prescribe Metformin, or you're taking Metformin at the moment, and this series is useful. In today's episode, I'll talk about how Metformin. The information provided is intended for Australian audiences only and is used by healthcare professionals. Please disclaimer. Metformin can reduce the blood glucose or sleep hospital wisely, which can improve the sensitivity to insulin above the fluid. Insulin allow the glucose to enter the insulin as difficult. This means you require the usual to open the loss. As a result, the pancreas produces more insulin. It's the going into the cell. Metformin helps the insulin feed effectively so that glucose the liver rather than food becomes the main source of glucose. When the blood glucose becomes low, the liver produces glucose to use. This occurs, for instance, in the early hours of the morning. The liver Metformin prevents the delay of the bloodstream.
2 steps by digestive and take the cell to be used can help to slow down the rate of this food.
What blood sugar measure or GSM?
Randomization was performed with the use of computer-generated random numbers. The analysis was performed according to the intention to treat results. A total of 50 women withdrew consent during the trial, which left 202 women in the Metformin group and 198 in the placebo group.
Please read this disclaimer and the following terms and conditions carefully before proceeding. Metformin is used for blood glucose in treatment. Firstly, due to sensitivity to insulin in the body. This in turn reduces insulin resistance. Insulin resistance is when the cells in our body do not use insulin properly. These cells include our muscle, liver, and fat cells. Insulin is a hormone which is produced by the pancreas.
Over the week, DSM.
Insulin is like performance which unlocks the cells to allow the glucose to be bloodstream and enter the cell to be used as fuel. In insulin resistance, insulin has difficulty setting to many cells.
The information Australia body is it is not replace advice given to you by please read this terms and conditions carefully before proceeding. 2. Diarrhea, which can sometimes be severe or sudden, stomach pain, nausea, vomiting, and loss of appetite. Up to 3 in 10 people, or 20 to 30%, will experience these side effects. Other than the vomit, feature symptoms failure. As a partner, they not the best of trip difficult to get closely and help by experiencing a side effect and equally secondly. About 2 weeks slowly changing may relieve the side effect at a time.
There was no significance between group difference in the median neonatal birth weight Z-score. The median maternal gestational weight gain was lower in the metformin groups than in the placebo groups, as was the incidence of preeclampsia. The incidence of side effect was higher than in the metformin groups than in the placebo groups.
Metformin is the way to absorb glucose from the digestive system into the bloodstream. Normally, the carbohydrates in food get broken down into glucose by digestive system. The glucose is then absorbed in the bloodstream and headed to cells all over the body to be used as fuel. After a meal, our blood glucose rises. Metformin can help to slow down the rise of blood glucose after meals, so that it does not keep us high or restricted. Because of this impact, metformin is used for blood glucose.
Hi there, where I teach. Became funerals during medieval times. Into people's jaws. Brains were releasing and consciously conform your response.
Let's talk a little bit about ways that the trachea.
Today's episode of podcast on the side effects of metformin and what actions taken is taken.
Conclusions. Among women without diabetes, more than 35, the
Information provided is intended to
antenatal administration of youth gain, but no neonatal birth weight.
Please read this disclaimer and the following terms and conditions diarrhea, which can sometimes be severe or sudden, stomach pain, nausea, vomiting, and loss of appetite. Up to 3 in 10 people, or around 20 to 30%, will experience these side effects. Other than the vomiting, I see these symptoms fairly often. Go away over time. As a pharmacist, I've offered the following for the first time, or if he or she is increasing their dose, it may not be the best time to do so just before a long trip, an important function, or a situation where it's difficult to get timely access to a bathroom. This can avoid the embarrassment and the trouble of experiencing a side effect at an inconvenient place or time. Metformin takes about 2 weeks for the full effect to be seen. The lower dose can then be slowly increased over time once the side effects have gone. Changing over to the slow-release preparation called the XR may relieve the side effects. The XR has a 7 milligrams at dinner time. This dose may be taken as 500 milligrams after breakfast and 1000 milligram strength tablet to the 500 milligram strength tablet.
Hi there and welcome to Brain Stuff. I'm Josh Clark and this is the Brain Stuff where I teach you about placebos and their effect. You've surely heard of placebos before. They're those phony drugs that real drugs are tested against. Placebos mean I will please in Latin, and originally it was applied to fake mourners who were hired to attend funerals during medieval times. Well, eventually this term for fake mourners was applied to fake drugs. Eventually, placebos became a permanent fixture of double-blind studies. Those are the kind of studies where the participants are divided into 2 groups. One group gets the real drug, one group gets the placebo. And if the real drug outperforms the placebo, then the real drug is successful. Hooray! The thing is, though, a lot of researchers noticed that some people who received the placebo still showed a favorable response to it. In fact, further research has revealed that as many as 1/3 of all people respond favorably to placebos. So let's recap this for a second. Actual sick people receive fake drugs and really get better. That's not supposed to happen. So, studies were launched to find out exactly what was going on. One study in 2004 in Michigan was particularly brutal but enlightening. It used actual painful injections that were harmless, but again painful, delivered into people's jaws. Then, the participants were given a saline injection that they were told was a powerful painkiller. The thing is, saline doesn't have any pain-killing properties, which means that the saline injection was a placebo. What's astounding, however, is that every single participant in the study reported a lowering of their pain levels after they were given the saline injection. And even more astoundingly, when viewed through a PET scan, the researchers found that the patient's brains were releasing endorphins, the body's first, the subject expectancy effect. That's where you, the patient, expect a certain outcome to come from, say, the fake drug, and you unconsciously conform your response accordingly. Then, of course, there's good old classical conditioning. But instead of Pavlov's dog salivating at the sound of the bell, patients respond favorably to what they perceive is a real drug, even though it's fake. We have to say, however, that the jury is definitely still out on exactly what's behind the placebo effect. Now, ethically, there's kind of a wrestling match going on. On the one hand, the idea that people can heal just through the power of their bodies rather than having to take powerful drugs that often have negative side effects is, as Martha Stewart would say, a good thing. But on the other hand, being truthful, honest, and transparent with your patients is a central tenet of modern medicine. So what is a physician to do? Well, some clever doctors have come up with
Let's talk a little bit about obesity and pregnancy. First of all, it's important to know that obesity does affect fertility. So if you are obese and you're having difficulty getting pregnant, maybe talk to your doctor about ways that you can try to lose weight and hopefully improve your fertility. That being said, people who are obese and get pregnant can have a trickier pregnancy. Obesity and pregnancy can lead to gestational diabetes, which can lead to larger birth weight for the baby and maybe even low blood sugar in the baby once he or she is born. So a healthy pregnancy really is one where you have a healthy weight if possible. If you're trying to lose weight and also want to get pregnant, a good piece of advice is try to wait until your weight loss has plateaued before you get pregnant, because then your body will be better able to support yourself as well as the developing fetus. I have patients who want to get pregnant after weight loss surgery, and it's perfectly safe to do so. However, we do recommend that patients wait at least a year, sometimes a year and a half after their weight loss surgery to get pregnant. Therefore, their weight loss has plateaued and they're more likely to have a healthier pregnancy and a healthier baby. So the take-home message really is a healthier pregnancy is possible if you're at a healthier weight. So if you're able to try to lose weight before getting pregnant, I highly suggest that you try to do that.